so many people here. I think we're expecting over 120 people to log in, which is just brilliant. And what we wanted to do was to really just tell everybody about NHIP Academy, what we're doing and where we want to go. And we're anticipating getting everybody together after the summer as we all move towards face meetings, when we really will get to know each other as a community. But we were really keen to do something before the summer just to kick all of this off. And it's really great that we've got so many people from around the region, so from Newcastle University, from Northumbria, from the trusts, from Sunderland, and it's just great to see so many people interested in the whole of the academic career development side, which is what we're here to do. So myself, I'm Dave Jones. I'm the director of the NHIP Academy that we're going to explain to you a little bit about, and then Nina is with me, who's the deputy director. So it's great that we've got a number of the people in our programs or linked into us to tell us a little bit about what they're doing and their sort of career development and career aspirations. So what we're going to do is just talk a little bit about the Academy. We're going to hear from some of the people in training programs across the region. Then we're going to talk a little bit about what the structure of the Academy is and what we're trying to do. And then there is plenty of time for questions. So please feel free to come up with any questions, any suggestions, any thoughts about what we're trying to do, any thoughts about what we could do, what we haven't been doing in the organisations in the past. So this is really an opportunity just for you to say or ask anything that you want. So I'll just give you a couple of quick slides to explain what we're doing and why we're doing it. I feel very dull in my colouring compared to Nina, who's bluer than me. Okay, lovely. So Newcastle, just before with that, we'll stay with that one. So Newcastle Health Innovation Partners, what is it? Well, it's a regional wide structure, and it is the Academic Health Sciences Centre for the north of England, essentially. And Academic Health Sciences Centre is a very specific thing. This is a national competition. It's a very prestigious competition that reflects excellence in clinical care, excellence in research, and excellence in training and education in the health and care sectors. So it's a real badge of esteem to the north, and it's a very important thing. And right at the centre of what we're trying to do in Newcastle Health Innovation Partners is train the next generation of people in this space. Those of you who don't know me, I've been working in this area for many years, both nationally and locally, to give the best possible support for people embarking on their careers, like I received many years ago now when I was embarking on my career. So this is something that we as an organisation, joint organisations, have always thought is very important. So it's the heart of the Academic Health Sciences Centre. So the key thing is that the UK actually has a really unique system to support the development of people's academic careers in both health and care. So health in the NHS sector, care in social care and in public health across the board. And it's something the UK is very proud of. I had a lot of work in NIHR, National Institute for Health Research, developing these programs. And one of the reasons why I went and did that in London with DHSC was because Newcastle had always had this big focus on it. So we've always done this. And what we want to do in the future is do it even better than we've done it in the past. And the reason why we have these systems in the UK is to attract, develop, and most of all retain the future leaders in healthcare research and in clinical practice. So it's all done for the individuals, but it's also to help everybody in our society by developing the future leaders. One of the things that's very unique about the UK is that we have quite an integrated system. So we have research awards at various different levels, bringing people into the system. I was meeting this morning with the medical students about their Inspire programme to bring people very early in their career into exposure to research. We go all the way through that to masters, to PhD, to postdoctoral awards, even to research professorships. So, and we will be there to help people throughout that pathway as they look to go through the various different stages and options. But the other thing the UK has always done is have what are called pathway awards, to give people confidence in going into the academic pathway. And these are the things that lead people from one opportunity to another. And that's what we're really going to focus on, getting the most opportunity for the most people through that. So these pathways are key. They give people confidence. They started with the doctors and dentists a number of years ago. They have now evolved into a very lively program for nurses, midwives, and allied health professionals. And NIHR and Newcastle NHIP Academy are looking to really evolve these into public health, social care, and methodology. So people can come into their research careers, combine them with their practice and their training that they need for that, and then sort of mature through the university system. And these awards attract and retain really bright people. They bring significant income to organisations like ours, and they're very high profile, and they really help you with your careers, and that's really important. So this is the way to develop your career. So next one. So in the city and the region, we've always had a very strong culture of this. We've always grown our own talent. When you look around the organisations and look at the real stars, many of them have come up through the system here. And I think that's very important, part of our tradition, our history. We were actually the people who in many ways pioneered the doctors and dentists model. I was involved in that 15 or so years ago. Nina and colleagues were at the forefront of taking this into the nursing, midwifery, allied health professionals. NMAP Plus is a concept we talk about, including pharmacy, healthcare science, very important areas. We did a lot of work in developing the concept of the NIHR Academy to do this nationally. And then we have a number of really important, prestigious training linked programs, such as the School for Public Health Research and other awards. So we have a whole ecosystem of these types of structures that really do support people. We have a community of existing and emerging leaders, and we'll hear from some of those shortly, in all areas of academic health and care, medical, dental, NMAP, public health, social care, methodology. So we really do have a rich community of people, but a lot of us don't know who the other people in this family are. And that's one of the reasons we want to develop the Academy, so that we can all learn who else is there, what they're doing, so we can connect up more, improve and innovate in our science. We have a really exceptional group of people here who are very experienced at supporting people to put applications together. But again, we can make it easier to access that. That's academic support, it's administrative support, it's grant support. So there are lots of people here to help you go on and be successful with these awards. And NHIP gives us a really good opportunity to take it even further. So we're a big part of NHIP, but NHIP is a big part of us. So it really does allow us to do this. And we want for the organisations to use this as an opportunity to increase research income, recruitment retention, whilst making your careers successful, so everybody wins with this. And most of all, the one thing we talk about all the time is that this is about you, the people who are developing your careers. This is ultimately not about universities or hospitals. It's about you. And it's a desire from all of us to make this about you, your career, and supporting you to be successful and to belong to something which is valuable and values you. So this is very much done for the right reasons and from the heart. So it's a desire to basically help everybody who's interested in going into this space to navigate their way through the system. So we're here to help, we're here to learn and to listen. And as the time goes by, we'll start to give a lot more detail about what that means in practice. So that's what I was going to say, and we'll take questions later. This is all about people on the training pathways, and it's about the diversity of it and the different types of science, the different types of the settings in which people do their research. And we're just going to hear a little bit from a number of our colleagues on the training pathway. So I think it's going to be Rhea first.
Hello. My name is Rhea. Can you hear me?
Yes.
Hello, my name is Rhea. I'm a senior research radiographer, sonographer working for Newcastle hospitals, but I'm also an NHR applied research collaboration for Northeast and North Cumbria in practice fellow. I'm passionate about improving pregnancy outcomes for parents and their babies, but I'm also passionate about finding new ways of working for benefits of the NHS and service users. So currently I'm applying for a PhD fellowship. My current project looks at empowering women to take the prophylactic medicine as prescribed. In a process, I published a number of papers and abstracts in peer-reviewed journals. I've attracted more than £100,000 in funding to support this program of research. And I also developed a wonderful network of support from clinicians, academics, charitable organizations, service users that support me in this project. As an early career researcher, what I really find valuable is access to mentorship, access to expertise and peer support that comes from across different organizations. So thank you. It was me.
Thank you.
Hi everyone, I'm Philip and I'm currently a Newcastle University Academic Track Fellow. So that's one of the in-house Newcastle University Research Fellowships. I started my career in social care as a home care worker and then became an occupational therapist and then an occupational therapy team manager. So all of the research that I do is grounded in that practice. I previously held NIHR Doctoral Research Fellowship and a Clinical Trials Fellowship, and I currently lead 2 NIHR social care funded studies. One of these is quite a large trial of major housing adaptations to bathing facilities for older adults. So it's quite unique in terms of the methodology of the trial within a social care setting. And the other study is an intervention development, which is looking at best practice for local authority reviews of 2-handed care packages, which is where 2 care workers are needed, and we use specialist equipment to reduce that package to a single worker.
Okay, so I'm grateful to have been invited here, but I would say I'm beyond junior. I've been very fortunate to do a research internship, nursing midwife allied health professional research internship supported by Vicky Smith and Professor Annette Hand, who have been exceedingly encouraging in helping me move forwards. I've had a long-term interest really in asylum health within maternity of pregnant women who are seeking asylum or have refugee status or are undocumented. And I feel that until recent years, this has been something that has not been on the radar in the slightest bit. Things are improving now in terms of the Embrace report that showed increased rate of perinatal mortality and morbidity for women from Black, Asian and minority ethnic backgrounds who are living in the very poorest of postcodes. But we're in a funny split in terms of that we're very aware as health professionals that it's the most disenfranchised that need the most input, and yet as a country things are heading in an extremely radical hostile direction that is not helpful for this client group. I've realised that my background of working in a low-income country is actually very relevant in that the clients that I'm working with, a lot of the health problems that they can have in a low-income country still follow them. But obviously there's additional issues associated with trauma as well, but also there can be attitudinal issues that it's very easy for us to, in a high-income country, to overlook, such as attitudes towards this, sustainable development goals, such as women's right to reproductive health care or contraception and so on. I'm really interested in working in a way that meets the priorities of clients. So we tend to segment care into this is your maternity care provider, this is your child health care provider, etc., etc. Whereas although someone's pregnant, their issues and major concerns can be for other members of the family or for issues such as housing and so on. So I'm networking with people across services to try and provide a more woman-centred, family-centred approach. And currently we're using a knitting group in one of the hotels, which is really building and enhancing people's sense of autonomy and so on, and support amongst them. And I've applied for a scholarship with ARC under the Supporting Children and Families, which I hope I'll be successful, but I don't know yet.
Hi everyone, I'm Susanna. I'm a public health specialty registrar and an NHR clinical lecturer. I'm a medical doctor by background, so I trained in medicine in Oxford and then moved to the North East in 2011 when I started my public health training. For those of you who are less familiar with public health training, as registrars, we generally train for about 5 to 10 years across a whole range of different settings to gain exposure to important issues in public health. So that includes health protection, which is now provided by the UKHSA, formerly Public Health England, come to the fore for a lot of us recently in terms of the COVID pandemic, also more recent issues such as monkeypox, and then many other outbreaks, incidents and diseases that have been around for a very long time. Many public health functions have relatively recently moved to local government settings. So we have lots of public health registrars who are based in local authorities, and they work with the Director of Public Health or DPH there and the local public health teams to tackle some of the key issues. And we also have a presence in NHS provider settings. So I've been fortunate enough to have a placement at Northumbria Healthcare Foundation Trust, and also my current placement is at Cumbria, Northumberland, Tyne and Wear NHS Foundation Trust. They provide mental health and learning disability services across the region, and that's been a fantastic opportunity to understand about some of the challenges and opportunities for providing public health in that setting. Alongside my public health training, I'm also a clinical academic. So I did an NHR doctoral research fellowship, which I completed in 2017. And that was focused mainly around understanding people's home food preparation activities and home cooking. And I've got long-standing research interest around diet, unhealthy weight, and the intersection with health inequalities. I've worked quite a bit with particularly vulnerable groups, so people experiencing serious mental illness or other vulnerabilities. And I'm also really interested in the intersection with environmental sustainability. So often we know that if people eat better for themselves, then they also eat better for the planet, interested in pursuing those research lines further. So I'm about to, I say about to complete my training. I've got another year or so to go, but thinking forward to future careers, I'm interested in pursuing a future direction that integrates both my public health broader training, but also continuing my research interest in those areas.
Hi, my name's Karen Marshall. I am a nurse consultant in Newcastle Hospital Trust. So I've been working in respiratory medicine for over 31 years and have a special interest in the psychological impact of respiratory conditions, and applied for an NIHR clinical academic fellowship in 2011. Was lucky to get that, so did a randomized control trial of looking at an intervention which I developed using cognitive behavioral therapy techniques for patients with chronic bronchitis and emphysema and symptoms of anxiety. And that was shown to be a fantastic intervention, helped patients' anxiety levels, but slashed hospital admissions and attendance to A&E. So it was a very cheap and effective intervention. So the key thing for me is being a clinician and doing research at the same time. That's something that I've been passionate about, and the NIHR gave me the opportunity to do that and still work clinically and do research. So I made a great network of fantastic researchers, such as Professor Yanis Vojagatis at Northumbria, people in London, Queen Mary's, and I'm doing some research in psychological well-being, but also physical activity using behavioral activations and trying to develop other ways to get that incorporated into clinical practice. So that's me.
And I am not Guy, but I've agreed to speak to his slide because unfortunately he couldn't join us today. So Guy represents the methodology colleagues in the trainee network. He's a School for Public Health Senior Fellow in Mental Health and also has an ARC Fellowship in Data Linkage and Assistive Technologies, and his background is in health economics. So his work focuses on the potential new avenues for linked health, social and environmental data, very much looking at the efficiency and timeliness of applied health research. And he's got a focus on supporting and building this capacity in others as well. So looking at developing the methodology that support linked data sets, research and evaluation of digital health technologies. So now I'll put on my own hat. So it's fantastic to see so many colleagues, many of who I know on this call. I'm Nina Kollehmainen, and like Dave said, I work very closely with Dave. I moved to Newcastle, I think about 9 years ago. And in the very first conversation I was here, Dave said, right, we want to make Newcastle the beacon of careers and development. And that's really what we want you to contribute to. So Dave and I have been sort of pushing for this space for a very long time. And the NHIP Academy is now really exciting way to bring together a lot of the program that, like Dave said, has been going on for a long time, well over 10 years. I think there's some challenges, I'd be the first one to put my hand up. Things are not perfect. It's been fantastic, but things are not perfect. I think one of the current challenges is that the offer, especially for the trainees, can come across still as quite piecemeal. So, I know Philip in the room, but I wonder if Philip knows any of the other trainees here today, right? And that's not unusual. I know Karen, but Karen and Beth are both nurses in the same trust, and I suspect they might not know one another. So we still have a lot of work to do around the linkage. Increasingly, the most successful applications span organizations, but navigating that interface can be challenging, as many of you know. The communications, internal and external, there's a lot more work we can do about that. And I think a lot of people recognize that we need to go further about really achieving the parity of esteem and opportunity across the different training pathways, across different backgrounds. But we equally need to maintain the sort of respect and value of the unique professional identities, context. Susanne said there, she's still very much a medic working in public health. We need to be able to work across these boundaries while still maintaining our identity and the unique expertise. And I think a lot of us are increasingly talking about, there's a lot of trainees in the system now. Where is the capacity across the system coming from? The trainees themselves, their supervisors, mentors, advisors, the underlying infrastructure. How are we sort of as a system supporting this and continuing to increase and allowing people to grow? So the NHIP Training Academy is really the next phase of where we see this going. And this now has the support very much from the Newcastle Health Innovation Partners Board. So the Academy brings together a lot of these existing programs, but in this federated structure that supports the development of the emerging programs as well, especially in the methodology and public health and social care. And it's always helpful to have a picture because that's a lot more effective than me rambling on for ages. So for those who don't know how NHIP itself operates, it's directed by the board that has the most senior members of each of the partner organizations sort of steering the ship. And then under that are 3 committees, the NHIP Research, the NHIP People and Culture, and then the NHIP Education and Training. Dave chairs the Education and Training Committee, and I'm the deputy chair for that. Under that, there's the education part and the training part. The education program is running very, very well. It's got focus on things like multiple long-term conditions, working in this new digital data landscape. The NHIP Academy is then the way how we are delivering the training part of the education and training. So it's the training structure of the NHIP, if that makes sense. And under that are 4 pillars: the medical and dental, which very much builds on the, like Dave said, 15 years of work that has gone in that space. It's got the nursing midwifery AHP plus, so that's very inclusive. It includes psychology, healthcare sciences, ambulance services, you know, anybody who's on that broad healthcare professionals list. And then public health and social care and methodology. And we get a lot of questions, right, are these kind of pillars as the boxes where we have to squeeze ourselves into? Absolutely not. You know, they are there as kind of connection points. Consider it as like an octopus with a lot of tentacles. It doesn't matter which arm you hold on to, and you know, you can move and work across pillars. So the question is, right, what next? What do we want you to do? So there's 3 asks. Do become part of it. Many of you already are, but like Dave said, we are hoping to have more in-person events. So do engage, do join in, make yourself known if you're not already known. Start spreading the word. Check the website, connect with the pillars. I think we can send the website link out to all the people who've registered if we've not done so yet. So do connect. No, you can self-identify which of the pillars you think might speak to you. Do become part of the network. And then as soon as you're starting to think about fellowship applications, as soon as you start to think about, oh, I'd quite like to get more involved in building my career and becoming part of this ecosystem, then just make contact. And I've included the NHIP Academy email address there. Don't just wait until you are like desperate now to do something. When you start to think about it, get in touch. So I think that's my last slide. And I think we're keen to move to the Q&A because we really want this to be quite an interactive session.
So can I just add a couple of comments to that? So just to, the first thing was about the pillars, and the main reason for having the sort of pillars is to do with the types of funding schemes. So it's very important that the information people get is relevant to the schemes that they are able to apply for. So for example, within NIHR, there are dedicated doctors and dentists programs, there are dedicated nurse midwife AHP programs, dedicated public health programs. And anybody is welcome to access any information they want, but going to seminars to learn about schemes that you're not eligible to apply for is not that useful. So it's designed to make sure that it sends you the information that's most relevant to you based on your profession. And the reasons why there are these different schemes are kind of lost in the mists of time. They're to do with where the money comes from. They're not always logical. So it's practical, designed to help you kind of get the information you want in the right way. But clearly, as Nina mentioned, Susanna kind of exemplifies, there are people who will have a natural home in more than one pillar, and it's very logical for them to be linked to more than one pillar. That's the first thing to say. The second thing to say is that the academy is a loose structure, and people ask me, you know, what's the qualification to be part of this? And the answer is to want to be part of it. It's as simple as that, is that if you're interested in potentially developing an academic strand to what you do as a person in health or care, then you're welcome to be part of this, and you can stay as part of this until you've reached exactly where you want to go. So it is a club that welcomes anybody and everybody. And we're not here to replace your supervisors, obviously not, because the relationship that is most important to your research is with supervisors. We're here to help with the more general bits, and also to help with you thinking about your career opportunities as you go on in the future. So obviously things like the BRC, the ARC, you've heard of, the School of Public Health, research, other structures like that. We have welcome fellowship programs, Cancer Research UK fellowship programs. Those, of course, are really, really critical. And the supervision and the hosting within those is the key thing for you. But as you move towards the end of those and are thinking about postdoctoral opportunities, that's when we are there to help. So we're kind of there in the background all the way through. Now, physically, we're going to have a home very soon. So by the time everyone comes back from their summer holidays, we will have our own home. We are in the Ridley 1 building here between the RVI and the medical school, and 2 floors above here is going to be our home, which is going to be a place that hopefully people will get to know. So we're going to have hot desking space and rooms to do meetings and things like that. So we will have a physical home, and that's great. We're going to appoint a manager who will help us coordinate all the things we want to do for you. That's going to happen later this week. We also increasingly do need to collect information. The funders want to know what happens to people. So we will be able to support data capture, which will help you with your applications. But really importantly for all of you, if you do put a fellowship application in, the funders like to know that you're in a structure that cares about you and supports you. And so we can help with the right sort of text you need to explain all of this, because the existence of this with a sort of strong pastoral element to it is really important for the funders. So this will strengthen your applications. And most of all, get to know some of the other people around in the structure, because I started out in life as a mouse immunologist, and I now do symptoms, quality of life and implementation science. And that's been a phenomenal journey, you know, exciting for me, and it's come from meeting other people. So we want this to be a really sort of live academic community. It's been difficult the last couple of years, but we're going to move towards being sort of much more interactive in person. So, and then the last thing is we will have, for the higher level applications where it gets very complicated, we will have some grant development support around all of that, so that help you put together those very big postdoctoral awards, which are really important for people's careers. So this is not all about structures, this is absolutely all about people, and it's about the things that you need to support you. But we do want to hear from you about what other things are useful to support you. So I just wanted to add a couple of other thoughts.
So feel free to start, either put your hand up, put questions into the chat. I know we had some pre-submitted questions, one of which was about, so what does the NHIP Academy actually do? And I've been trying to think, how does one summarize that? Because those of who, you know, someone like Karen, who's been in this system and trying to do this clinical academic or practice academic, build your career, it's quite a complicated thing. And it makes me think back to a picture that often appears in these conversations, which is snakes and ladders, and building your career, whether you're methodologist or practice academic, it can be a bit like the snake and ladders, and you don't always know where the snakes and the ladders are. And even the supervisors don't always know that, because the picture is quite complicated. And I think that's what the academy is kind of trying to do, is to bring a lot of that intelligence, a lot of the expertise together, so that collectively we become a lot better knowing where the snakes are, where the ladders are, how you might want to navigate that career. And like Dave said, there will be a lot of options, and you need to kind of choose at different time points, which journey are you going to take next? So that's how I kind of see the academy, but I don't know if other people maybe want to chip in with that. Do put questions in.
So can I give you a semi-philosophical version of that? So if your research and your supervisors are the melody, we are the rhythm for research. So we're in the background, in a sense, continuity over a length of time. And it is, it's one of the things I love, is that I can name the numbers of professors in the organisation who I first met as students. And Karen, you and I first met 11, 12 years ago. I told you it was a good project then, didn't I? And I'm not sure you believe me, but it was. So we get to know people over a long period of time, and we're of course not usually directly involved. So we're not supervising projects, and that kind of allows us to give some sort of context to it. So it's help with the big picture for applications. It's intelligence about the schemes. Schemes change all the time. What you'll find is that there are lots of schemes that are really oversubscribed, but the same funder will have another scheme which is undersubscribed. So it's actually opportunities for people, little niche things which it's well worth people thinking about. So that's all very important. And then it's about future planning around the options, your career and how you might want to put all of those things together. And then the kind of independent thing we do is obviously very useful around interview support. So whereas a fellowship itself is very much driven by the science, you do need to have the other bits around you and your career and the ecosystem which you operate. So that step back that we can do is very helpful for people to sort of present the view you'll need to present. So we're there to supplement everything else. We're there to kind of take the long view and to help people.
We've got a question from Laura, who I know, and lovely to see you, Laura. It's been probably about 2 years since we last spoke, and I recognize your challenge. So I don't know exactly where you are just now, but why don't you just, drop an email directly to me and Dave, and let's follow that up. So I recognize, some people come into this network with a much more straightforward starting point. Other people, I think, especially traditionally, maybe the landscape around where they are starting from might be a bit sparser. Things have moved on since we last talked about. So I think it would be useful to just drop me and Dave an email, and we'll pick up a conversation with you.
So just on that note about mentorship, I think that's really important, is that people sometimes ask who a mentor is and why do you need a mentor as well as a supervisor. So in NHR, all the funders think this is really important. So the supervisor is the person you're going to talk to day to day about your research, about designing your experiments. However, there will come times in life when a supervisor's interest and your interest might be different. So often where people are at the postdoctoral level, the best thing for the supervisor is you stay and do a postdoc with them because you're experienced, you can do the experiments, but actually that might not be the right thing for you. And so a mentor is somebody that you get to know who takes a sort of step back view of it all so that they can give you guidance about not now, but 5 years and 10 years time. And so a lot of the relationships I've got with people around the place are those sorts of long-term, you maybe only see each other once a year or something, but you're always there to give guidance and give a view to people. I think it's really important. Now, mentors will come from wherever they come from. So most people find a mentor through the relationships that they develop. But if people are struggling, then we will absolutely be very happy to find people for you who will be supportive. So systems that try and give everybody a mentor, it's like trying to force relationships. It doesn't work. Find your own mentors, but if you're struggling, we can absolutely help out. And I'm famous for picking up mentees all over the place, doing the most extraordinary different things across the piece. And it's absolutely fascinating. You find out so much about the rich sort of world. It's extraordinarily valuable. So do have a mentor. It's really helpful. So I saw a question flipping through for Marika about, we do have formal qualifications. So in the education program, we do have a number of formal types of talk course things, including a master's in clinical research. So there will be a variety of formal educational opportunities, but we will also be developing webinars and be putting those online around the practical aspects for people that are important. So if you like the more mechanical bits of putting an application together, so we will be doing those programs. We'll do them live. We'll let people know. We'll be very welcome for people to join, but we will then put them on the website so people can access them later. So there will be a library of that type of quite specific content. And if you, as a community, if there's anything you would find really useful, please tell us and we will pull together a webinar on it. So one of the nice things is there's so much goodwill around the place about this. So if there are things that people would find useful, do let us know. Use the email address we've showed you, we'll pull something together.
There's been a couple of questions that I think all lead to a similar answer, which is about the sort of connections, future events, what's actually going to kind of happen on the ground. I don't know if any of the pillar leads are on the screen. I can only see the screen one, but feel free to come and mute and chip in. Some of the pillars are already putting, and I think have dates in diary of events they're planning to host in the autumn. Others are in the process of planning that. So like Dave said, we're planning and hoping to have quite a bit more in-person events. And those will also be open to the supervisors or potential supervisors. So I don't think we are planning a kind of a marketplace of come and sell your research ideas, because most people who go and want to develop a career in leading their own research come with too many ideas to start with. However, there is of course that element of how do you find the other people who like to work with those ideas? How do you connect and find the senior colleagues who you want to work with? And I think those pillar meetings, and we're hopefully going to have a whole academy meeting as well, you know, making those really, really interactive and giving you all a lot of opportunities to connect with other people.
And I've said, I agree with that completely. It got very difficult through COVID, everyone knows that. But this idea, fundamentally, one of the things we want to do is to anybody or everybody out there who is really excited and interested in all of this, we want to find ways to help them to do that. And that can include matching people up with exciting opportunities. So there will be, and this speaks to Stu's comment in the chat box about pitching ideas, is that there are lots of opportunities and lots of people who are interested, and they don't always know who each of them are. And I think those are really interesting ideas. And so some things like sandpit opportunities are a really interesting thing. And I think as we do get back to all being in the same room together, we'd be interesting to sort of do those. Dragon's Den and things like that are very exciting types of things. So they can be fun as well. We want to make this fun. I remember back in a different life when I was a dean of research, we did a Dragon's Den type exercise with real research funding at the end of it. And that got people interested and excited. They stopped us doing it after a little while because we were spending money. And you had to meet up with somebody you've never worked with before and then develop an idea and pitch for pilot funds for it. And we can just make things exciting like that. So John Sayers just put up that the medics and dentists have their annual meeting on the 30th of September. So this is one of the pillar meetings, and this is because of the annual cycle of people coming into the pathway programs in medicine dentistry. So that's always been there as a way for people to get to know each other. But we will anticipate equivalents for the other pillar groups, really just to allow people to get to know each other a little bit more, sort of support some networking with all of that. But we're not here to tell anybody how to do things. We're not telling anybody how to do things. We're here to facilitate people doing that. So a certain Kath Exley, not sure who she is, I joke, she's director of the PHSI. So is there a plan to bring all pillars together in one meeting in the future? Absolutely. And there is going to be, we're going to have a booking on the James Spence Lecture Theatre to bring the entire community together at some point. And we will need the big lecture theatre because there are a lot of people in this space, which is brilliant. And part of the excitement of this is the cross-disciplinary working. And I think particularly in the NIHR view of the world, it is that the NIHR view is that the best quality care is delivered by different professionals working together in an informed, research-informed setting, bringing their own expertise to bear. And we are in a multidisciplinary world, and that creates multiple opportunities. And I think that is the really exciting part of it. And the ARC and the BRC definitely lead the way with that type of multi-professional working. So we will think about an innovative way to do that rather than just having a session for the doctors and dentists and then a session for that. We'll think of a thematic, creative way of doing that. So definitely. So Karen, who is the lead for the NMAP pillar?
Does anybody know? You can cheat by looking on the website. So we are still in the process of identifying. Yes, Lindsay, please do come. I saw you unmuting there. Please do.
Lindsay, do you want to say hello?
Hello. Yes, I am one of the leads for the NMAP pillar. So we have leads from the different institutions that are involved, and I'm the lead for Newcastle University. And I have said that I will chair some of the meetings.
Lovely. So for those people who don't know Lindsay, she's a speech and language professor in speech and language therapy at the university and has done absolutely sterling work with colleagues to support NMAP applications over the years. And our program of fellowships in that space has, and you can see that the people we have around has been extraordinary. And I think that's a big area to develop. So we will need leads for all the different organisations. Just to say that Northumbria University is part of this, very important, because there are undergraduate programmes in nursing, midwifery, allied health professions. But also we're getting increasing links with Sunderland, and we are very keen to develop links with other organisations. This is not about fiefdoms, this is about people, and the ecosystem for nurses, midwives and AHPs is much more diverse than it is for other professions. And if you look at where fellowships go in that space from NIHR, it is universally distributed across the country, whereas perhaps for doctors and dentists, it's focused in a smaller number of centres. So we are developing programmes, and John Unsworth, who worked with us very closely from Northumbria, has now gone down to Sunderland, which will help the development of all of that. So we can't solve everything right at the beginning, but there's a direction of travel with that. So Lindsay and colleagues from NAF are setting it up with developments coming from CNTW and then Northumbria University.
Hi, Maria. Are you there to give away
Hello,
for the
hello.
CNTW NMAP leadership?
Yeah. So obviously for CNTW, we're really keen to support NMAP careers. So I'm there at the moment for CNTW. We're having internal discussions for our nursing representation, but yeah, very exciting times.
Lovely.
Yeah, can I also say, sorry, I can't get my camera to work today, I don't know why, but having discussions that we cross the whole of the allied health professions and mapping out who is where and how we can support people best across the institutions, the HEIs and the trusts, so that we do that, and it isn't just a few of the AHPs that are represented, and also the healthcare scientists are represented too, and pharmacy. So we're really going broad, and we want to support people across their career pathways, wherever they are.
Yes.
So I'm really liking your comments about Sunderland, Dave.
Yeah, no, absolutely. And I think that point is very well made, which is that in the region, we have phenomenal strength across the spectrum of professions. I think that's a real strength. And there are something like 22 allied health professions, and the range of areas that I have spoken to people from, and that reflects the way we need to deliver care in the emerging sort of world, isn't it? So paramedics, I've had conversations the last few weeks with paramedics, with physios, with nurses. I myself supervise a dietitian. So there's a whole load of really interesting opportunities. And I think there are two areas that NIHR is particularly keen to develop, because they're areas that have had relatively fewer applications than perhaps other areas have had in the past. One is pharmacy, because of the evolving and developing role for pharmacy, and obviously the region is very strong in pharmacy. Andy Husband's on the call with the pharmacy department here, but also across the region, Sunderland, historically in the space of pharmacy. And the other one is this area of healthcare science. And for those of you who kind of don't speak NIHR, that seems very strange, because we're all in healthcare and we're all doing science. So what's a healthcare scientist? What they mean by that are people who are running the technical aspects of care delivery. So in imaging, in physiology, in respiratory function, in transfusion, in areas like sort of bypass sort of devices in surgery. So it's what used to be medical physics, but expanded in lots of different directions. And that's a really important area. As we get to a very high-tech world, you need really skilled people to be able to optimize the delivery of those technologies. So that's what healthcare science is. And so that's a really important area. And we have some really sort of great programs in that space.
Dave, can I just follow up? Just so you were talking about pharmacy there, we did have a question come in through registration, which was, does NHIP collaborate with pharmaceutical companies in the Northeast or elsewhere?
Yes. So in terms of working with industry, obviously, that's a very important part of the conversion of science into practice. So, and that's a very broad sort of type of relationship. So everyone thinks about the pharmaceutical industry, but also the diagnostics industry. So we have a very big program in diagnostics here with the NHIP, and clearly that's about using technology to the best advantage of patients. Also engineering and devices. So we are perhaps in a sort of stage in medical science where there are going to be fewer new drugs and more scientifically informed ways to use those drugs. So that area is really interesting and really important. So NIHR and MRC, Cancer Research UK, all support co-applications between themselves and industry. So there are joint programs between industrial partners and the funding body to facilitate the moving of science through into practice with industry. And so all of the structures here, I'm in a different life. I lead for the industry interface within the BRC, and I think that's a very important thing to do. They are a little bit bespoke, those projects. So I think if anybody is interested in doing, in a sense, research at the industry interface, then probably that's one to bring straight to me, actually, in order to look at those connections. But the funding bodies really do like to see this, partly because it allows their money to go a little bit further, but partly also because it facilitates translation into practice. And it's a little known fact that the mandate for NIHR is to improve both the health and the wealth of the country. And everyone focuses on the health, but they don't tend to focus on the wealth. So there are lots of opportunities. But I think if people are interested in that, that's probably one to bring straight to me.
Would any of the trainees like to give any final thoughts, reflections, comments, or any final questions from the audience, or indeed from any of the other pillar leads? No? I don't think we need, Karen, yes, please do chip in.
I was just going to say, when I started my journey, there was nothing like this. There was absolutely nothing, and it was just by chance that I managed to get some help, but because one person knew the way to go. It was like plodding through treacle. But the help that I got was absolutely fantastic, and things like helped me to word the application so it brings out your strengths, or to the mock interview that I'll never forget, Professor Jones, you did, and it was horrific.
I apologise.
It was, but it prepared me so well for the interview, which I thought was a doddle. So I have to say that it's just great to see this in development, so that you've got a go-to place to come to guide, help you through this tricky process that it can be.
You're very kind, Karen, and I'll send the £20 in the internal mail. That's all right. I think if I was to define, what are we really trying to do? I think it's about individuals and feeling confidence and to feel that they belong to something. It's a belonging thing. But in terms of the applications, I think what we do is help with the last 10%. So the first 90% of an application comes from you and your hard work and the science and all of that. But the last 10% is the bit that wows the panel. And I think we've got we have a disproportionate number of panel chairs and panel members in Newcastle, which reflects the training track record. And I think all of them would say the same thing, is that it's that last 10% that really allows people to ace it and be successful. And that does need the little bit of the external view for it. So I think that's to look after the interests of the individuals through the structures and within the system, but also at individual level, and then helping them with that last 10% is probably the main thing. And the vast majority, it's now, absolutely people get their fellowships through their own hard work and their own success. But if we can just help in a tiny little bit, then that's, great for everybody.
Do you want to answer the question about the clinical academic office?
So the clinical academic office, in the words of Monty Python, is no more, it has ceased to be. It is a dead clinical academic office. So NHIP takes over from the clinical academic office. So the clinical academic office was quite a narrow structure in terms of overseeing medicine and dentistry with a little bit of NMAP activity, and it didn't really support people in other areas, and therefore it wasn't quite as diverse as it could have been as we move forward into a world where all of these different professional areas are supported. So NHIP takes a much broader world view. And we also wanted to move away from the term clinical academic office to the NHIP Academy. And it's a line I used to use when I was in NIHR. I was kind of involved in the creation of the NIHR Academy, which looked after the interests of about 2,500 people in training across the UK. Hence my comments about NIHR. And the NIHR Academy took over from the Trainees Coordinating Centre. And one of the lines I used to use is that nobody wakes up in the morning and dreams of being part of the Trainees Coordinating Centre. And I think a little bit the same applies to the clinical academic office. It rather puts the administrative process side of it to the fore. And an academy is a community of academics living and working together. And I think that mindset is much better. So it's partly to broaden out so that everybody is supported, and it isn't just this group in, that group out, which is unfair, and partly to slightly change the kind of perception of it. It's about academic development, it's less about process. Would you add anything to that?
Yeah, I think the only thing I would like to add, and this goes really back to what you said there in your question or comment, Karen, is that I think that's what the NHIP Academy for me is. It is about the community, like, when you say, Karen, that nothing like this quite existed back then, but you've been very much part of creating this. Karen joined this call and sent her slide in this morning, right? Because that's the kind of person Karen is, and that's kind of what being part of this community means. Beth got this random email from Annette saying, can you be, joining to this office? I can still see that Philip's not quite recovered from still thinking, why am I here? What am I doing, right? But that's kind of the spirit of the NHIP Academy. It's about all of us chipping in, all of us being willing to share that 1 hour of our time to say 2 minutes about what you've done, and actually giving an opportunity then for other people to hear, oh my gosh, there's Beth or there's Philip, and they're doing something different. And, that kind of collectively moving forward. And if each of us chips in a little bit, actually really, really benefits all of us.
And it's just this idea that you can meet other people and think, well, they're just like me. They've done it, I can do it. And that people inspiring that their colleagues is exactly what you want to achieve.
Maybe got one question we could end on, which might be quite a nice one, which is, how should an established consultant new to the region get involved in ongoing or new projects? I think the answer is get in touch.
Yes, and I think there are increasing number, not going into the schemes and things, but there are increasing numbers of opportunities now for people who perhaps have done research in the past and then have moved off into service, because we all do that. We're all in the worlds we're in. Sometimes we do research, sometimes we do service. So there are lots of opportunities for people to get involved in research. And I think part of the kind of mentorship thing is, as you say, if you're new, you don't know who does what. And actually, in a past life, I was a head of a research institute, and half my life was spent just connecting one person up with another because of what they do. So very large organisations across the region, there are so many different diverse areas that people operate in, and if you're new, you won't know that. So we can help with all of that. So I think there are great opportunities for that. All of the trusts are very research active, as the universities are, and they bring that really critical, clinical context, the local authority, the social care and public health side very engaged in all of this. So lots and lots of opportunities. And it's the authenticity of the questions that people ask because of their life seeing the challenges on the ground that leads to very high quality research. So the message is, do it. You won't regret it. Okay. And we'll be nice in the mock interviews.
Thank you so much to everybody for joining us, and yeah, definitely stay tuned, get in touch, get connected, and when you come back from your summer holidays, we'll be doing more in-person stuff.
Okay, thank you everybody for joining us.